Hello everyone. So today we are going to learn about Sentinel event. So what is a Sentinel event? A Sentinel event is an unexpected event in the healthcare that involves death, serious physical or psychological injury. So it is a very sad topic today, like emotionally draining. So it is known as a Sentinel event when it involves death, a serious physical or any psychological injury. It or any event that carries a risk for such an outcome and requires immediate investigation and response. So, for example, you must be knowing about codes of hospital. So, when there is code blue activated, it does signify that there is any cardiac emergency. So this also comes under a sentinel event. So it carries a risk of such an outcome and requires immediate medical investigation and response. Let's move further. So let's dive into some examples of sentinel events. This is a very important topic for forensic medicine, like not in the sense of theory, but it might come because you never know how things work, and but it is important for your future career and all. And it is also important in Viva. Like someone might ask you anywhere, like Sentinel events. These are some events that do happen in hospital. Like it is very common in hospitals. So let's go with some examples. So first one is procedural errors. So surgery on the wrong body part or the patient. For example, if there was a leg amputation surgery of the left leg, but by mistakenly a doctor operates on the right leg. So that would become a procedural error and a sentinel event. Then medication errors. So a wrong drug or wrong dose causing death of the patient or causing any illness like any terminal illness or any death that might lead to uh, that is a sentinel event. Then patient safety failures. So fall in hospital causing fracture. So sometimes there is rush, and if the rush is not properly managed, you can get stampedes and all in the hospital during the time of emergency, and it can cause patient safety failures. So example is fall in the hospital causing a fracture. So then suicide. So suicide in inpatient under supervision. So inpatient, what does inpatient mean? So inpatient means ward patients. So anything apart from ward is known as inpatient. Anything that any patient that stays in the hospital apart from OPD is known as inpatient or ward patients. So the department is known as IPD. So suicide of inpatient under supervision. So when a patient is under supervision of doctors and security staff, and his or her like he or she commits suicide, that would be a big problem and is under a sentinel event. So then device malfunction, so oxygen failure or ventilator error. So this is also important problem. Like this might happen, and this has happened in so many hospitals. Like not in mine, but there are so many hospitals. Like you know what happens if there is a power cutoff or any problem which a hospital doesn't cope up with. Like even the generators fail, then ventilator error might happen. Similarly goes with oxygen failure. Like there is not enough oxygen uh, present, like enough oxygen cylinders present in the hospital, or the oxygen. Nowadays, hospitals have oxygen pipelines. Not nowadays, like it is since a long time. But if there is a default in if there is a fault in that pipes, it might cause oxygen failure and lead to device malfunction. Then maternal and infant harm. So if you will study PSM properly, you will learn about maternal mortality and infant mortality rates. So that does signify the development of the hospital, the development of the healthcare in a particular country. So infant mortality rate is the best indicator, and death of child under 5. But then maternal mortality rate also defines the effectiveness of the hospital. So infant abduction, that is kidnapping of an infant, maternal death in low risk cases. See, there are some high risk cases in obstetrics, like diabetes, that is gestational diabetes, then epilepsy, that is a part of preeclampsia, that is raised blood pressure, and eclampsia, which also leads to epilepsy. And these are some high risk cases. But a maternal death in a low risk case, like not a primary actually, but a mother who is delivering for the second time, is and has no problem and has delivered a normal baby before, so that mother comes under low risk case. And in fact, the gestational period is between 37 weeks to 42 weeks, so this is a low risk case. Then transfusion error, so incompatible blood group transfused. So you know what happens if there is a human error or maybe machine error is there. The tests are not getting properly. So in transfusion errors, incompatible blood groups can be transfused. So if a patient has B blood group and is transfused with A, then the patient might get transfusion reactions, severe transfusion reactions, like host and graft, reaction, etc. I'm really sorry for the noise behind me. Actually, these people are bursting crackers. Obviously it's Christmas, so Merry Christmas each and everyone, and hope your year ends well and the new year goes very fine. We'll make a video this coming Saturday and Sunday. So in that, we wish you Happy New Year and Merry Christmas, my dear people. So let's go further. Please bear with this. I'm really sorry. Legal relevance of Sentinel events. So, what can Sentinel events lead to? So, a Sentinel event can lead to civil negligence, criminal liability, and legal suits. It violates the duty of care. So, what is duty of care? So, in our first video, we have learned about medical negligence. So, a duty of care to a doctor is a duty to which he or she complies of doing the duty for the good of the patient. Like it's hers professional, and it's an oath that doctor takes that he or she will serve to the patient and provide the best service possible. So if there are sentinel events, it might violate the duty of care, and it comes under negligence under IPC section 304 subsection A. In some cases, it can involve criminal charges if proven intentional or grossly negligent. So gross negligence. So let's just revise, okay? What was gross negligence? I hope you guys remember. So what is gross negligence? So extreme lack of care or competence. For example, wrong patient surgery that we have seen in our example, if you remember, right? So let us move further. Yeah. So we are done with this. Then we have ethical principles that are violated in Sentinel events. So first one is null maleficence. So we have seen this before also. So what in Sentinel events is null maleficence? So it is direct harm to the patient. Then beneficence, like failure to protect the patient, or obviously a failure to protect the patient is a failure of the hospital to operate, a doctor to work. So just remember that. Justice. So unequal or unsafe care to the patient, and accountability. That is lack of reporting and transparency. So that is self-explanatory. Justice, that is unequal and unsafe care. So you know what happens if you don't have enough money to pay to the hospitals. It is not everywhere, but some or the other place it has been inside the system of the hospital, and that is injustice to the patient. Accountability, so lack of reporting of lack of reporting, that is not reporting on time or transparency, etc. That is that comes under accountability. So then, what is a protocol? So first of all, remember this is a very important step in Sentinel events. It might take a lot of time. We will complete it quick. Okay, so protocol for prevention of Sentinel events. So the first one is identification. What is identification? So it is recognize event as a sentinel incident. So if an event happens in front of you, what as a doctor or as a general physician or as a general surgeon, what you have to do? So you need to know some things, like you need to identify it as a sentinel event or it is not a sentinel event. If it is not a sentinel event, you can grossly modify it, like based on the knowledge you have. But if it is a sentinel event, then you have to notify internal safety and quality department immediately. So if you work in a hospital, you might be knowing they have internal safety and or they have both the departments, like internal safety department and quality department, quality control, you might have heard this. Then immediate reporting. So the report is to be made, report to the hospital administration or risk management department. And external reporting if required. So NABH and NMC, that is National Medical Council. These are national medical organizations, councils. So you have to report them if it is required. If there is a major accident or a major sentinel incident in your hospital, you have to report it to the National Commission of India. Yes. So you have to do the root cause analysis. So RCA, this is very important because investigate what, why, and how it happened, and use tools like fishbone diagram and five-way analysis. So we learn something about it. What is a fishbone diagram and what is five-way analysis? First of all, what is root cause analysis? So what is root cause? So if you have some problem, you have to go dig down deeper. You have to understand what is the cause of that thing. So digging up to the roots and getting what has uh, pursuing that what went wrong and what could have been better. So what, why, and how. And we'll do the fishbone diagram and five why. So we'll draw the diagram. So the first thing, this is one arrow. So it is measurements. Measurements. Then let us do one thing. Like we'll get the diagram and we'll study it. Okay. I'm really sorry. We'll get the diagram. Okay. So let's learn this. So this is basic cause and effect diagram. So this is a fishbone diagram. So you can see measurements that the arrow goes a bit deeper. Then environment, machines and processes. Then measurements, materials and people. This all leads further to the problem. So this is how you can get to the solution. Like this is, you can see here also. So material specified hardness to high. So this is something related to different fields. In our fields, the examples are important. It is not at all important for the theory. So if you want to learn, you can watch a video related to it. So technically, what is 5i? So for example, we have an example here. The patient was late in the theater. It caused a delay. Why it caused a delay? There was a long wait for the trolley. Then why there was a long wait for the trolley? A replacement trolley had to be found. Why? The original trolley's safety rail was worn and had eventually broken. And why it was broken? So it had not been regularly checked for wear. So why? So you can understand there was a delay because the original trolley was not checked for regular wear. Like it was not regularly checked for the wear, and that is the root cause. So now you can start to think of the solutions. Start to thinking of solutions. Okay, so we are done with the root cause analysis. That was very important. Then after the analysis, obviously once the analysis is done and you're sure that this is the root cause of that thing, we'll go with the co-reactive action plan. That is also called as CAP. So you have to change the protocols, retain staff, retrain staff. So if a big problem was not handled by a particular staff or particular protocols, you have to change every single thing. Like don't have to change the staff, but you have to add on members. You have to get rid of unnecessary protocols which only wastes time and adds upon the problems. Then add checklists, add safety measures, then implement technology, that is barcoding, alerts. So this is a very systematical approach to any Sentinel event. So once a big event happens in some big hospitals or even small city hospitals, you can understand if something big happens. Or for example, what happened in COVID-19 uh, changed every single thing about respiratory medicine and every other branch of medicine. So they had to add checklists, safety measures. There were different, like for example, RT-PCR and oxygen saturation, which was very impaired in COVID-19. Then to implement technology, that is barcoding and alerts. Like if some big things happen, uh, barcoding alerts, you have that codes of medical college, or sorry, medical hospitals and all. So for example, I had given you that example of code blue that was there for any cardiac emergency, majorly about cardiac arrest. So you have to initiate CPR, then attach defib if it's important, if the rhythm is shockable. So that is a deep thing. You have to learn it in your final year, and you should obviously learn it whenever it is possible. We'll teach it if it's possible for us to teach it here. Then monitoring and audit. So monitoring or audit, that is periodic audits and safety drills. So audit is what you do at the end of the year or starting of the financial year, that you have to get everything collected by every information about the working of the institution and all. You have to present it. So audits are general body meetings that encourage incident reporting culture. So non-punitive, that is any incident is happening, you have to report it as soon as possible. Then training and education. So continuous medical education, that CME. It is very normal nowadays. Like there are so many conferences related to it, and continued medical learning, CML, or continuous medical education. So training and education about different diseases, different surgeries. Like for example, there was like when minimally invasive surgery, that is MIS, then robotic surgeries, then laparoscopic surgeries. When they were introduced to the doctors who have graduated long back, they didn't have the knowledge of those things. But because of continued medical education, they can still learn about very old, very senior doctors who have only performed major surgeries, like major cardiothoracic surgeons. So they can obviously study minimally invasive surgery or maybe general surgeons. That is, they can also study robotic surgeries and laparoscopic surgeries. Then we conduct ethics workshops and safety simulation training. So that is basic life supports and ALS, ACLS. So advanced care life support. So you know what happens in emergency? You have to provide care to the maximum amount of people which are possible, and so here comes the concept of triage. So we learned that in some other video, like where we have time and where we have in-depth presentation for it. We learn about that. Then what is informed consent? Informed consent and communication, that maintain clear documentation. Yesterday I taught you consent wala thing. So if you have informed consent, that is a written form of consent where a patient knows each and every detail about his or her operation and surgeries and everything, like in his or her vernacular language. It is a clear documentation. If you have signatures of the patient and the doctor as well, you have proper clear documentation of the thing. Then, and also it is important to be transparent with the patients and families post event, like after the event. Like if you have to break a very sad news to the patient's family, you have to be transparent with the patient and the families, and it is very important for you as a doctor. So here we are done with, let me see once, I hopefully we are done with this. So then we have professional indemnity insurance. We'll take it in some other lecture, like maybe Saturday or upcoming Saturday or Sunday. Let's see. So here is something about Sentinel events. So it is very important to learn about this. Here is a quick recap. You can, if you want, you can take proper screenshots of this slide. So what is a Sentinel event? Then examples of Sentinel events, legal relevance of Sentinel events, ethical principles violated in Sentinel events, protocol for prevention of Sentinel events, and so these are some seven only, I guess, seven protocols. So be aware with these protocols because it is very important. It is going to come in your future practice. So keep learning, keep studying, keep getting these experiences. Okay. Thank you a lot. Thanks a lot, people. Yeah, I'm a little bit nervous. I don't know why, but it's okay, I guess. We'll learn. We'll learn with time. Okay. All the very best. Thank you.